Welcome back. Strokes affect many families in our community, which is why it's so important to shed some light on National Stroke Awareness Month. CHRISTUS Trinity Mother Francis has a stroke program, and registered nurse Mari-Carmen Kennedy is here to tell us everything we need to know. Good morning.
Good morning.
Okay, so you guys have a great program over there.
Yeah.
Tell us about what you guys are doing at the hospital.
Well, we are accredited by Joint Commission to make sure that you guys get the best stroke care possible. We use evidence-based practice to guide our practice to ensure that you get good stroke prevention and stroke care in an emergency.
Awesome.
Well, tell us about this code stroke.
Right.
Okay. Well, if you come into the hospital pretty emergently, we have a short amount of time that we can treat you for a stroke. It's about 6+ hours, so it's real important that you get there quickly. And when you do, we activate a stroke team to make sure that you get the care that you need and get you to the right place in time.
Oh, so you have a whole team that works on one person then.
Mm-hmm.
What are they looking for?
We are looking for symptoms of stroke, which include weakness on one side or the other, facial droop, difficulty speaking or understand the spoken words, excuse me. Sometimes it's an acute onset of a headache or sudden dizziness or nausea and vomiting.
Yeah. And you're also certified as a stroke center. Tell us about that.
Well, we work with the Joint Commission. We've been certified since 2008 to ensure that our patients get really great care and that they go home understanding how to prevent this from happening again.
Right. So what are some of those tips that you recommend then?
Well, we want to make sure that you go to your doctor if you have high blood pressure, if you have diabetes, high cholesterol, and an irregular heartbeat called AFib. We want to make sure that you're exercising and eating a healthy diet and watching your weight. Those are all things that can prevent you from having a stroke.
Right, good advice.
Right. And also, I understand that sleep apnea can be a cause of strokes as well.
It can be.
Then, okay.
All right, any other causes maybe?
You know, there's some real rare causes, like an arterial dissection of the vertebral arteries and things like that. But your typical causes are your highest cause is high blood pressure. So we want to keep that blood pressure down.
Yeah, that sounds important.
Yeah, and also I understand arteries can be clogged, and then that could can that lead to one too in your neck?
Absolutely. Most recently, we've added a program at CHRISTUS Trinity Mother Francis that offers 24/7 neurointerventional radiology, where if you have a large clot in your in one of the vessels that lead to your brain, they can actually go in by arteriogram and pull that clot out and possibly reverse all the symptoms of your stroke.
That's incredible.
Absolutely.
Oh my goodness.
Very exciting.
And so for the most part, like, is stroke something that's treatable?
It is, but you have to get there quick. Like I said, you have a really short amount of time. We have medication that we can give to dissolve the clots that are causing the stroke. We have the neurointerventional radiologist that can pull the clot out, but it takes the time to get there. You have to get in an ambulance, get to the hospital quickly so that we can have that time to treat you. After a certain amount of hours, there's what you've got is what you've got. So it's really, really important to get to the hospital quickly.
Yeah.
We actually use the ambulance services around that they notify us before you get to the hospital so that we can activate that team a little early, and we'll meet you at the door and whisk you off to wherever we need to get you for that treatment.
Perfect, yeah, especially when time is of the essence.
Absolutely,
That's key.
time is brain.
Oh yeah, oh man.
And how do we find more?
Perfect, that's gonna be my question.
Oh, absolutely. CHRISTUS, TMFHS is our new website. .org, I believe. And then strokeassociation.org is a really great place to look for some more information and tips on how to control your blood pressure and diabetes and things to decrease those risks for stroke.
Awesome. Well, thank you so much.
Thank
Great
you.
info. All right, well, coming up next on Fox 51.